So again, just to recap, your central nervous system, it's made up of the brain and the spinal cord, and any pain is transmitted via a receptor, and it sends the message to the brain, and the brain interprets the pain, and then it sends a motor message down the spinal cord to your finger or to your leg or wherever it is that you got hurt. So the central nervous system has something called the reflex arc, which we kind of touched on before. So remember, this is just to recap. Let's say this is actually a very good example of something that just happened to me the other day, where my son, he's only 2, he bit me on my leg. And so what happened was, when he bit me, there was a sensory receptor on my leg, and it took the message to my brain, okay? And it told the brain that I'm hurt because my son bit me. And then the brain processed it, and it sent a message through the motor neuron, and the motor neuron was going to tell my leg to move away from my son. It's going to push my leg back. Okay, so remember, sensory receptor, sensory nerve. This is the one that sends the message. So S for sensory, S for send, sends the message to the brain, and then motor neuron is the one that sends the message back and tells you to move your leg. Now let's look at the peripheral nervous system. So peripheral nervous system are all the branches from the brain and spinal cord. So you can see it goes all the way down to your arms, it goes all the way down to your leg, to your toes, so it extends everywhere. And we have 3 different components that we're going to look at. So let's look at the spinal nerves. So the spinal nerves is right here. So here's your spinal cord, and you can see there are many nerves extending from the spinal cord. And notice that there are 31 pairs. So there's basically 31 of these. And what I want you to know is that there are sections. So cervical nerves makes up C1 to C8, so which means there's 8 stems. Then we have thoracic nerves, then we have the lumbar nerves, the sacral nerves, and the coccygeal nerve, right? Okay, so there's many different nerves that stem out of the spinal cord, and these are known as your spinal nerves, and they're broken up into these sections. Now, when we look at the spinal nerves, what I do want you guys to know is that this right here is your spinal cord. It's a cross-section of the spinal cord, and there's something called the dorsal root and the ventral root. And if you remember from last time, the dorsal root is also kind of similar to the sensory root, so it's the one that sends the message of pain, for example, to your spinal cord and brain. And then your ventral root is your motor root. So the motor, it means movement. So it's the root that goes down here, and it tells your hand to move. Now, when we're looking at the cranial nerves, and remember, the cranial nerve is this brain that we're looking at. If we look at the brain, this is like the shaded brain that you see over here. We look at the inferior view or the inside view of the brain, you can see that there's many different cranial nerves, and they're different colors. Just to outline that there's many different ones. And this is a famous mnemonic to memorize. These 12 cranial nerves are listed over here. So this is the actual name of the cranial nerve. And then we also have mnemonics so that you can remember the O stands for olfactory. The next O stands for optic, and the second O is number 2. Number 3 cranial nerves, the O stands for oculomotor. So it's just a way for you to remember. This is not entirely the most appropriate, I know, but this is the most common one that people use to memorize the cranial nerve. So you can make up your own. I'll leave that to you as to how you want to memorize the cranial nerves. This over here, there's a video in the notes section of this PowerPoint that I do want you to watch, and this is actually really cool because this is actually a face drawing, and it tells you what each cranial nerve refers to. So let's go over this briefly. So remember, there's 12 cranial nerves. That's why you'll see numbers from 1 to 12 all listed here or all shown here on the face. So number 1 is right here, and number 1 is known as your olfactory nerve, and your olfactory is for smell. So this is that's why this is like your nose, because it helps you provide sense of smell. Then number 2, this is your eyes. This is known as your optic nerve, and your optic nerve provides you the sense of sight, so you can see. That's why it's on the number 2 is where the eye is. Number 3, you can see number 3 kind of, which in funny is over here, And this is your oculomotor nerve. And what your oculomotor nerve does is it's the one that raises your upper eyelid. So that's why you can see it's on the top of your eye, because it helps you raise your upper eyelid. Then number 4 is over here, and this is your trochlear nerve, so trochlear nerve. And this is the one that, so basically beside the eye, there's something called the superior oblique muscle, and what it does, it moves your eyes down, and it also kind of moves that side as laterally as well. So it's kind of over here because the superior oblique muscle is over here, and it's the one that moves your eye down. Okay, it also can move it laterally as well. Laterally means side. Then number 5, and you can see number 5 makes up of the bulk of your face, right? And this number 5 is known as your trigeminal nerve, and your trigeminal nerve is a nerve that innervates or supplies most of the skin on the front part of your face and on your head as well. Okay, so it's a nerve that supplies the top part of your the most of the skin on the front part of your face and head, and it also gives feeling to like the oral cavity, so to the mouth. So you can see the 5 is also like around the mouth area because it gives a lot of feelings to or sensation to the mouth. And we'll look at that later on. Actually, we kind of touched on it before when we were looking at trigeminal nerve, and we were looking at local anesthesia and when to numb the max teat. The nerves that stem from there is all from the trigeminal nerve. So we're going to look at that later on. So trigeminal nerve makes up the bulk of the face. So that was number 5. Number 6 is this one right here, and you can see this is known as the abducens nerve, and this is right beside the eye, and that's because it helps with the eye movement in terms of. So when the eye moves side to side, this is the one for side to side. The abducens nerve is number 6. Number 7 is your facial nerve, and you see how it is also a very big number over here, and that's because if you remember, we talked about muscles of facial expression. So the muscles of facial expression, which are muscles that help you smile, the muscles that help you, frown, the muscles that help you raise eyelids, can help you squint, the muscles that help you make that kissing motion like this. So these are all innervated by the facial nerve. So number 8 is known as the statoacoustic nerve. The statoacoustic nerve is known as right here, which is your ears, and acoustic come from sound. So this is the one that helps you hear and also helps you balance. So the sound and balance comes from the statoacoustic nerve. Number 9 is your glossopharyngeal nerve, and glosso stands for tongue. So glossopharyngeal. So if I actually break out the word glosso and pharyngeal, glosso means tongue. Pharyngeal comes from pharynx, which is your throat. So this is kind of like the back of your throat and your tongue. And it innervates those areas. This one actually innervates the posterior third, so the back third of your tongue. Then we're going to look at number 10. And number 10 is your vagus nerve. Okay, so number 10 is over here, and this is like a really big nerve. And what it does is it sends down the sensation basically it gets sent through the muscles of the pharynx, so the throat, larynx as well, even the soft palate, and it goes all the way down to the rest of your body. So it goes to all the smooth muscle of the body, it goes to the cardiac, so heart muscles, and all the glands in the body. So it goes all the way down. Number 11 is your accessory, or spinal accessory nerve, and this is the one that helps you shrug your shoulders, for example. So that's why you can see it's near the shoulders. And then lastly, we have number 12, which is the hypoglossal nerves. And hypoglossal, so glossal looks at tongue, and this one innervates the tongue as well. Okay,